pleasure to introduce our keynote speaker, Dr. Noor Gajraj. He is a physician at North Texas Medical Anti-Aging Center. He's a leading educator, academic scholar. He's also a podcaster, and he's on several boards, including the American Board of Pain Medicine and the American Board of Addiction Medicine. He's authored more than 100 publications and delivered more than 500 lectures, both nationally and internationally, and we're thrilled to have him joining us here on our virtual stage today. He's going to present Live Longer, Live Better, the Longevity Blueprint, and this contains insights from his latest book, which I encourage you to check out. That's called 100 Pathways to Longevity, Add 25 Years to Your Life. So you can join me on the stage here now.
All right, well, thanks. Thanks everyone for listening. So I've written this book and it's got 100 pathways to longevity. It's a long list. All of those pathways do have some science behind them. I'm a great believer in looking for the science. Longevity, there's been a huge interest recently, but we have to make sure that we're not dealing with speculation, wild claims, little research. So that's really what I look at, and I'm going to present you, um, you know, factors that are definitely important for longevity. So I've got that in the way a little bit. We'll put it down here. Okay. Okay, so longevity is not just about living longer, but about living better. Now, we're moving from a disease-centric healthcare model to a health-centric one, a sick care system to a true healthcare system. Now, we do not have a good healthcare system in the United States. It's a sick care system. We have one of the most unhealthy populations in the world, which is quite shocking. Although we spend the most money per capita on health, but it's not working. So the goal is not to just add years to your life, but to add life to your years. Now, this is important. A lot of people will say, well, my genes are bad. I'm not going to live that long. My father died when he was 50. My mother died at 70. We got terrible genes. But we now know that the influence of genes is only about 20 to 30%. So most of what we do to live longer is going to be lifestyle. Lots of good lifestyle choices. Now, no matter your age, you'll always wish you'd started sooner. But today is the youngest you'll ever be. And in 10 years' time, you'll look back and say, I wish I was back there again. But the good news is it's never too late to try and improve your health. Now, when you have a birthday, um, take comfort in that the older you live, the longer you're going to live. So at birth, your expectancy is about 75 years. But if you get to 65, which I have, expectancy is 81 years. And if you get to 75, your expectancy is 85. So the longer you live, the more birthdays you have, the better the future looks, as long as you keep healthy. The older I get, the happier I am being at home doing nothing. So that is a tendency as we get old. We stay at home more. We don't go out as much. Our social interaction can be less. So let's just be aware of how our lifestyle is changing as we get older. Now, we alluded to this before we got on this morning. Most people want something quick, pills in this case. pills and supplements so that you can live longer. But lifestyle is much, much, much more important. But unfortunately, there is a sort of barrier to a lot of people doing the necessary lifestyle changes. All right, so I talk about 7 pillars of nutrition. Number one, sorry, 7 pillars for longevity. Number one is nutrition. Now, unhealthy diets contribute to an estimated 678,000 deaths annually in the United States from diseases like heart disease, cancer, and type 2 diabetes. A diet high in processed foods and low in nutrients is a leading cause of disability. Unfortunately, we have probably the worst food in the world, highly, highly processed. Once something gets into the processing factories, we kind of lose control. There's a lot of preservatives, uh, colorings. There's sugar everywhere. I'm going to talk about how bad sugar is, but it's everywhere, and it shouldn't be. We don't need added sugar in our diet. We get plenty from just eating a healthy diet. Um, and we're going to talk about watching how much added sugar you take in. Most people don't have a clue about how much they should take in, and why sugar is so bad. A study found that adopting an optimal diet rich in whole grains, legumes, and nuts could add an estimated 13 years to a man's life and 10.7 years to a woman's. Even starting at age 60 could add 8 years. Now, here are the main dangers of added sugar: weight gain and obesity. Added sugar, especially in sugary drinks, contributes to increased calorie intake without providing satiety, leading to weight gain and significantly raising the risk of obesity. Obesity, in turn, is a major risk factor for many other chronic diseases. There's an increased risk of type 2 diabetes. High intake of added sugar can lead to insulin resistance, where the body's cells become less responsive to insulin. This forces the pancreas to produce more insulin, eventually leading to pancreatic fatigue and increasing the risk of developing type 2 diabetes. Heart disease risk: high triglycerides. Excess sugar is converted into fat in the liver, leading to elevated triglyceride levels, a known risk factor for heart disease. High blood pressure. Sugary diets can increase blood pressure, further straining the cardiovascular system. Inflammation. Added sugars promote chronic inflammation throughout the body, which is a key driver of atherosclerosis, which is hardening of the arteries, and other cardiovascular problems. Cognitive impairment and Alzheimer's disease. High sugar consumption can lead to insulin resistance in the brain, impairing its ability to use glucose for energy, a connection sometimes dubbed type 3 diabetes. Additionally, excess sugar promotes chronic inflammation and oxidative stress in the brain, both of which contribute to neurodegenerative pathology. Non-alcoholic fatty liver disease. Fructose, a component of added sugar, is metabolized by the liver. Excessive fructose intake can overwhelm the liver, leading to the accumulation of fat in liver cells, even in people who don't consume alcohol. This can progress to more severe liver damage. Dental problems. Added sugars provide an easy food source for bacteria in the mouth, which then produce acids that erode tooth enamel, leading to cavities and tooth decay. And there's an increased risk of certain cancers, such as breast, colorectal, endometrial, and liver. See if I can get this out the way. Oops, it's a little stubborn. Anyway, poor mental health, mood swings and energy crashes. Rapid spikes and drops in blood sugar can lead to irritability, mood swings, and feelings of fatigue, increased risk of depression and anxiety. Some studies suggest a link between high sugar consumption and an increased risk of depression and anxiety, though the exact mechanisms are still being researched. Accelerated skin aging, advanced glycation and end products formed when sugar reacts with proteins in the body can damage collagen and elastin, leading to premature wrinkles and accelerated skin aging. Now, this is something that a lot of people don't know about. How much added sugar is recommended? Now, the American Heart Association recommends limiting added sugar intake to no more than 6 teaspoons or 25 grams per day for women and 36 grams per day for men to avoid these significant health risks. Now, that's not very much. And what I would recommend is that whenever you buy something, particularly in a packet or a can, look at how much added sugar you're taking in and try and keep it within those limits. Very, very difficult because the food industry really pushes added sugar at us. Candies are just, 40 grams per candy. Sugary Coke is about 40 grams. It's very easy to get above those limits without consciously looking at how much added sugar there is. And as we've said by now, sugar is very, very bad for you. It's bad for every organ in your body. And, when I see patients coming in with, a sugary drink, 40 grams of sugar, kind of concerns me quite a bit. Exercise. I thought you said extra fries. No, we want exercise. So, pillar two, exercise. Exercise and lifespan. Physical inactivity is a leading risk factor for non-communicable diseases. The World Health Organization estimates that 4 to 5 million deaths per year could be averted if the global population was more active. Regular physical activity can reduce the risk of many types of cancer by 8 to 28%, heart disease and stroke by 19%, and diabetes by 17%. How it adds years. Regular physical activity has been shown to increase life expectancy by zero point 0.4 to 6.9 years, with many studies pointing to an average of about 4 years. Sorry. I'm going to talk a little bit about protein because you covered this a couple of days ago, but we now know that protein intake is very important, and the recommendation now is about 1 gram per ideal pound of body weight. So this is the old recommendation. It used to be zero point 0.8, but that was considered the minimum to prevent deficiency. Many experts argue that the recommended daily allowance is outdated. Um, you get this straight, especially for active and aging individuals. Why higher protein intake is recommended? Higher protein combined with exercise combats age-related muscle loss, which is sarcopenia, and prevents weight regain following initial weight loss. Protein increases satiety, so you feel satisfied compared to other foods, helping you feel fuller and aiding in weight loss by preserving lean muscle. Metabolic health. Skeletal muscle is a key metabolic organ, and higher protein intake supports its health and function. Decreased mortality. Higher intake of total, decreased mortality. Higher intake of total protein was associated with a lower risk of all-cause mortality, and intake of plant protein was associated with a lower risk of all-cause and cardiovascular disease mortality. Um, going back to exercise, it's not just muscle strength, it's also flexibility, posture, and balance. And we need to address all of those as part of our exercise regimen. Going to give you an interesting statistic. If you are not able to stand on one leg for 10 seconds, you've got a 78% chance of being dead in the next 10 years. Because standing on one leg really assesses a lot of things, your balance and muscle strength. So, and that's what we're looking for. It's not just your actual age, but your functional age. You know, what can you actually do? You want to be able to do your normal activities, and most people lose strength in their legs first. Now that's a really bad sign, because if you don't have good leg strength, you're not going to be able to get off a chair very easily. You're not going to be able to get off the toilet easily. So we have to maintain our muscle strength, particularly in the lower limbs, and our flexibility and our balance. So coming to stress, chronic stress can accelerate the aging process at a cellular level, shortening the telomeres and potentially reducing lifespan. High stress is linked to a higher risk of heart disease, high blood pressure, and impaired immune function. There's been a lot more focus on stress over the last few years. Stress is a killer, and reducing stress is extremely important. Key takeaway: practices like mindfulness, meditation, and deep breathing can mitigate the harmful effects of stress on the body. It is said that if you can just do one or make one conscious breath per day, that's going to be a benefit. Just take a breath, breathe in, breathe out a few times. Better than nothing. Most people don't do anything. Okay. Sleep, the ultimate reset. Now, lack of quality sleep can increase the risk of heart disease by 48% and has been linked to a tripling of the risk for type 2 diabetes. Sleep deprivation can also age your brain by 3 to 5 years. According to research, better sleep habits could boost a man's life expectancy by an average of 4.7 years and a woman's by 2.4 years. Prioritizing 7 to 9 hours of quality sleep per night is one of the most powerful things you can do for your health. Social connection. The stats. Loneliness is linked to an estimated 871,000 deaths annually worldwide. A lack of social connection can be as harmful to your health as smoking 15 cigarettes a day. If you look at a lot of the research coming out recently, a lot of it is on loneliness, and it's probably going to get worse as time goes by. Strong social connections can lead to a low risk of early death and better overall health outcomes. People with strong social relationships are found to live an average of 3.7 years longer than those with poor social relationships. Number 6, purpose. A study found that adults over 50 with the highest sense of purpose were half as likely to have died 5 years later compared to those with the lowest scores. how it adds years. While difficult to quantify, research suggests that a strong sense of purpose can add several years to your life by promoting healthier habits and greater resilience. I got into the human world to find purpose, but this whole thing is just an elaborate version of fetch. Now, mental health. This is a big one. The stats: serious mental illness can reduce life expectancy by 10 to 20 years. Psychological issues like loneliness and unhappiness may increase a person's biological age more than smoking. How it adds years, improving mental well-being and managing conditions like depression and anxiety is crucial for extending both life's health span and lifespan. Now, there are about 25,000 homicides in the United States. That is half the number of suicides. Suicides is 50,000. So statistically, you're more likely to be killed by yourself than by someone else. Quite shocking. People don't even talk about suicide. It's extraordinary. How many people just don't even want to mention the word? So those are the seven pillars. But I might even add an eighth pillar, which would be hormonal replacement. Of course, as we get older, there are going to be changes in estrogen, mostly for women, and mostly testosterone for men. So balancing these hormones is very important. Now, with estrogens in females, there's been a lot of controversy about the harmful effects. That really relates to a study many years ago that was debunked. It was a very poorly designed study, and the results have been debunked. Now, there are so many benefits for a woman being on hormone replacement therapy. Studies have shown that women were less likely to develop Alzheimer's and bone fractures, and they had a 50% lower risk of dying of a heart attack when they started hormone replacement therapy within 10 years of menopause. So, any ladies here, I would recommend that you have your hormone levels checked. If they are low, definitely consider replacement because estrogen is good for your bones, your heart, and your brain. A study showed that participants who took estrogen alone lowered their risk of breast cancer by 23% and lowered the risk of breast cancer death by 40%. It's been shown to reduce the risk of a fracture. Now, if somebody falls down and fractures their hip and they're elderly, the 1 year mortality is about 20%. So you really want to avoid people falling and breaking their hip. I'm a great believer in hazard reduction. I just put a rail on my front steps because I'm thinking about the winter. There's a lot of ice, and if you stumble, I wanted a handrail there. Very important to be able to hang on to the handrail. That's a phrase that comes up because grip strength is very important because if you stumble and you grab hold of something, you've got to have the strength to stay upright and not to fall. So reducing fractures, very, very important. And HRT reduces the risk of heart disease by about 50%. One study showed that hormone replacement therapy in women lowered the LDL, which is the so-called bad fat lipid, and insulin resistance, while HDL, the good fat levels, were higher compared to placebo. Women who take HRT have been shown to have a 25 to 45% decreased risk of colon cancer, depending on the type and duration of HRT used. HRT may delay the onset of type 2 diabetes. And a study has shown that severe gum disease was 44% lower in women taking HRT. So that might really surprise you, especially if you've heard a lot about the negative effects of estrogen. I'm a great believer in it. My wife is on estrogen replacement together with testosterone, and she says it's a miracle. Um, so, in terms of men, now, if the men listening get their testosterone level measured, it may come back as within the normal range. Now, for me, it might be at my age 400, but we don't want normal, we want optimal. And what we're trying to do is get the testosterone level to that of a young person, so 900, 1,000. So just because it's normal doesn't mean it's optimal. And that goes with a lot of replacement therapies. Now, testosterone replacement can increase libido, improve erectile function, and enhance overall sexual satisfaction. Testosterone plays a vital role in muscle development and it contributes to bone health. It can help increase bone mineral density, reducing the risk of fractures and osteoporosis. It also enhances mood and energy levels. Some men report improved mood, increased energy levels, and a greater sense of well-being. However, it's important to note that testosterone replacement therapy is not a treatment for depression or other mental health conditions. Other positive effects: cognition, it's good for your brain, red blood cell production, body fat distribution. Testosterone's conversion to estrogen is essential for bone and vascular health, preventing excess visceral fat and promoting insulin sensitivity. Now, I'm sure you've heard a lot about GLP-1 agonists, and I've prescribed it hundreds of times, and I'm a big believer in it. Um, Cardiovascular benefits. So some studies suggest it may, like semaglutide, may have protective effects against heart attacks, strokes, and sudden death. So definitely more benefits than just weight loss. Research is exploring its potential benefit for brain health, improved insulin sensitivity and glucose metabolism. This may reduce the risk of metabolic diseases and their associated complications. Kidney protection. Research suggests it may have beneficial effects on kidney function, which declines with age. Reduced liver fat accumulation. This is a key feature of non-alcoholic fatty liver disease. All right, supplements. You've heard a lot about supplements, and there are hundreds of them. But this is, every expert in this field is asked, well, what supplements do you take? So I take quite a lot, but these are the main seven for me, my magnificent seven. Taurine. Recent compelling research, including human observational data and animal studies across species, worms, mice, monkeys, indicate a decline with age and significant benefits for health span and even lifespan from supplementation. Most taurine supplements contain doses ranging from 500 milligrams to 2,000 milligrams per day. Magnesium. It's essential for over 300 biochemical reactions. Its widespread deficiency is linked to numerous age-related diseases, cardiovascular, metabolic, neurological, bone health, making adequate intake crucial for healthy aging and health span. Common dosages typically range from 200 to 400 milligrams per day. Vitamin D, this is a big one. Most people in the United States are vitamin D deficient. It significantly impacts bone health, immune function, and risk of various chronic diseases associated with aging, making optimal levels critical for maintaining health span. Daily supplementation often ranges from 1,000 to 4,000 units for most adults. Um, Now, when you get your blood result back, just don't go for normal. Um, it's recommended that the level be 60 to 80, for example. Creatine, primarily known for muscle and brain health benefits, maintaining muscle mass and cognitive function are key aspects of health span. Its role in cellular energy is fundamental. Recommended dose is 5 grams per day. Now, omega-3 fatty acids, excellent. A lot of beneficial effects. Supports their cardiovascular benefits, anti-inflammatory effects, and potential to reduce telomere attrition, all of which are fundamental to promoting health span and potentially healthy aging. Recommended dosing is 2 grams per day. Probiotics and prebiotics, again, I believe you've gone over this subject in quite a lot of detail. A healthy gut microbiome is increasingly recognized as a cornerstone of healthy aging, influencing immunity, inflammation, and overall systemic health, thereby contributing to health span. Curcumin, as a potent anti-inflammatory and antioxidant compound, curcumin targets multiple pathways involved in age-related diseases, showing promise for improving health span despite challenges with bioavailability. For general health benefits, dosages in studies typically range from 500 to 1,500 milligrams a day. So I've covered a lot of ground. It's not longevity isn't a secret. It's not a secret. It's a science. By focusing on the 7 pillars, which are nutrition, exercise, stress, sleep, social connection, purpose, and mental health, you can take control of your health. And I would actually add hormonal balancing to that. Um, Now, when we're asked, or you'll see, what improves brain health, what improves gut health, it always comes back to those 7 pillars: brain health, nutrition, exercise, sleep, stress reduction, social connection, purpose, and mental health. All of these um, relate to really any part of health. Now, just to conclude, everyone is an individual. We really have to find out what works for the individual person. There's biological variability. So, for instance, in tests for hair growth, individual results varied. So, I'm going to stop there. I hope I've given you some insights. So I'm going to over to you again, Maggie.
Yes, excellent. Thank you. And again, as we mentioned, you have your new book, so lots more insights that people can glean from that. So I encourage everybody to check that out. So please post your questions into the Q&A and we'll get to those now. We have about 10 minutes left for questions. We did have one come in asking about environmental impact in terms of kind of overall health. Sorry, I'm dropping my
Yeah,
internet.
I mean, the environment you live in has quite a big impact. So, for instance, toxins, mold. There is been a lot of discussion about microplastics. You know, they're everywhere. They're even in cans. And you shouldn't microwave. By the way, you shouldn't microwave anything that's plastic. Big problem. And then there's things like the quality of the air is going to have an impact. Even your environment, if you have access to nature. Hadn't really talked about that, but spending time in nature is beneficial. And that's there's no really one thing that that is involved in longevity. There's no like one thing. I mean, there are important things. Probably exercise it is the most important thing you can do. But there are so many other things that can be helpful. You know, getting out in nature, um, listening to music, dance, challenging your brain. Maybe do 15 minutes a day do something to challenge your brain. Maybe do a puzzle, or maybe learn some foreign language phrases, that type of thing. Yeah, I wanted to say a little bit more about the GLP-1 agonists. There seems to be a lot of negativity recently. Well, not a lot, but we talk about semaglutide face, and people are losing too much weight. Um, those are those effects. If anybody that loses weight is going to lose muscle, and the way to compensate for that is to increase protein intake and do resistance exercises. And by the way, in terms of muscle health, um, it's really variable resistance that has been focused on more. So get yourself some exercise bands. As you exercise, the tension changes. So it's very easy. By the way, uh, in terms of exercise, one recommendation is you can space it out. So instead of doing 30 minutes of cardio, do two 15-minute sessions, or three 10-minute sessions. It's better than nothing, but we have to be able to do something. It really should be the same as brushing your teeth. You brush your teeth to keep them healthy. We need to exercise to keep healthy as well, and we should really put it up there as a priority because, as you know, if you don't have your health, you don't really have much.
Yeah, I'm wondering
Anyway,
how.
I'm an advocate for the GLP-1 agonists. I'm on those. Um, I I mean, not just for weight loss. I mean, I did lose some weight, not a huge amount, maybe 15 pounds or so, but I'm staying on it because of the beneficial effects. What I'm interested in is um, brain health in particular. Because again, if you don't have a healthy brain as you get uh, older, it's going to be a problem. And in my opinion, the brain is the most important organ. A lot of people might not think so, but uh, brain health is important.
Absolutely, yeah. So we had a question come in, you talked about HRT. Question come in from a post-menopausal woman who, because of the Women's Health Initiative assessment, she avoided HRT at the time of menopause. So it's now been 20 years. Is it too late for her to
No,
benefit from HRT?
no, not at all, because you want to at least protect the bones. And a lot of women, as they get older, you can see, become very frail. And that's another thing I should talk about, frailty. Now, if you look around at older people, I mean, they may not have that many diseases, but they're very frail. You can look at their arms, they're very small. Their, their posture is, they lean forward. They may have, with osteoporosis, you lose height. Um, your spine sort of squashes. You may have heard of wedge fractures, but and the balance is bad. So you want to avoid frailty, and you want to have good bone health. You want to have good posture. Um, all these things are important. So you've probably heard that the FDA did look at safety, and they've taken away a lot of those concerns. But in answer to your question, yes, that lady would benefit from taking estrogen because of all the beneficial effects. And then women do need testosterone as well. Testosterone is more for energy, muscle strength, um, libido. So I'm a big advocate of hormonal balance. Um, and it doesn't have to be, I mean, I didn't have any symptoms from my testosterone level, but I wanted to take it to maintain my muscle mass and some of the other beneficial effects. So those two things, semaglutide and hormonal balance, I do myself, and I'm an advocate. Um, that women's health initiative was a big problem. It really turned many people against hormone replacement. You know, the risk of breast cancer, strokes, heart attacks, but all of that has been debunked, and that publication was severely criticized.
We had another
Pretty
question come in on the HRT topic, so I want to stay with that for a moment. Obviously, everyone should consult their own healthcare provider, but just in general, how long should a postmenopausal woman stay on HRT?
forever. Yeah, just stay on it forever. Yeah, we don't. You know, my wife's on it. Estrogen, as I say, she could get her over it. She's in the other room, but she's a huge advocate of it. It's made a huge uh, benefit to her mentally and physically. But yeah, I mean, you know, a lot of, you know, I mean, the science hasn't really penetrated to a lot of doctors. So your primary care doctor might say, no, you know, we're not going to do that for you because they're not necessarily up to date with you know, the way that the research has gone, and maybe they're thinking more about that old study that has been debunked. Um, but yeah, it's good.
All right, question also came in. So just if you were forced to rank, we all understand it's holistic and all these pillars are important, but if you were forced to rank, we were asked what would be the top two? They're guessing nutrition and exercise, but what would be the top
Correct.
two?
Yeah, correct. Yeah, nutrition and exercise. You know, if you were to pick, and I always get this question, you know, what's the one thing? But you know, there really isn't one thing. I mean, you could say that, you know, perhaps the focus on, you know, exercise, posture, balance. I think that's going to give you um, more bang for your buck, if you like. But they're all important, you know. You can't really ignore any of them because they are interconnected. You know, if you have a lot of stress, you're not going to sleep well. So they're all interconnected, in my opinion. Social connection. You
That
know, it's
has come
bad
up
for
a
you.
lot
Causes to
over these days,
yeah.
the social connection being so important.
So I mean, one thing you could consider is I say, you know, do what young people do, apart from silly stuff. Do what young people do. They socialize, they're active, they have fun, and you know, as we get older, we need to try and be a bit more like a young person, not sort of fall, you know, into these habits of being sedentary and you know, basically not having fun. I mean, I think the you know, one of the purposes of life is to be happy in this world without drugs and alcohol. Um, you know, it's tough. Modern life is difficult. You know, we're not really we haven't, you know, as our evolution has progressed, we're not really adapted to modern life very well. You know, where we evolved for you know, just surviving and reproduction, but you know, people, we're not really a lot of us equipped, especially young people, social media. Um, People don't feel as safe as they used to. They feel that the world is unstable. Um, I mean, young people don't think their prospects are as good as other generations. They're a little more, you know, negative about it. Yeah, so you know, we have to learn how to cope with the stresses of modern life, and they're, you know, they're enormous. I mean, they're almost, we don't recognize it. So yes, stress, sleep, three S's that I remember: stress,
Excellent.
sleep, and social connection.
And
Um,
and I'll say, I don't know how many people out there, when you were talking about balance, I stood up and balanced on both legs to make sure I could do it. So I don't know how many people put themselves to that test, but uh,
Yeah, it's an alarming statistic, and yeah, I was kind of thinking, well, I don't want to do that test and not be able to, but most people can. And I'm not saying that, you know, don't if you do it and you can't If you do that test and you can't stay up for 10 seconds, I mean, don't be alarmed. It just means that it's something to work on. I mean, you don't want to leave it like that, put it that way. So
Yeah.
you want to address your balance and your flexibility and your muscle strength. I mean, it's important. I mean, I think Ian Smith was saying the other day. I mean, the benefits are so well established. I mean, why wouldn't we do it? One reason is we got too much other stuff going on that we don't put our health as a priority. But you know, actually, if you were going to ask me what's the most important thing, I would say, make your health a priority and set time aside for that. I did do a talk on it's almost micro exercise. You're active throughout the day. So, for instance, after this, do 10 squats. Sit on the chair, stand up. Sit on the chair, stand up. Simple stuff, right? People say, tap your feet while you're on your computer, or little stuff. Use the stairs.
Yeah.
Walk. So, incorporate exercise into your daily routine, and then you won't notice it as much. I mean, in these Blue Zone projects, these individuals were not going, these people with longevity, they didn't go to the gym. They were just active. They were sitting on the floor, getting up, cooking, might be doing their laundry. We don't do anything pretty much. Everything is, we got laundry machines and all kinds of stuff that result in us using our muscles less.
Yeah. So just get out there, sneak it in. And I think
Yeah,
it's a great message
yeah,
to
keep moving. I mean, if you can do some lunges, do some squats. I mean, it's better than nothing.
better than
Uh,
nothing.
do
Yeah. I mean,
some, do
it's
some,
so, you've inspired us to show the little ways that we can take action. So we are out of time, but I appreciate it.
oh,
Like I said, I stood up, move my arms around, do something, and just
yeah,
we can sneak it in and make it fun. So
yeah, do a 10-second plank.
there you go.
And if you have trouble, it's a lot of these things are you want to test yourself. So once you stop being able to do stuff, you think, well, I better work on something to
Yeah,
get this better.
excellent. Well, thank you very
Thank
much.
you.
As I
It was
said, you have a
great.
wonderful book. I encourage everybody to check that
Yeah,
out. And we appreciate you joining us. Thank you.
it's a pleasure. Thanks so much, Maggie. Thank you. Please subscribe to my channel and read my new book, 100 Pathways to Longevity: Add 25 Years to Your Life, available on Amazon.